As a physician who's cared for the elderly and impoverished patients, I have a very real and personal concern for those without the resources or the ability to provide for themselves. It would be a great burden and motivation on every American's heart that elderly individuals, however few, are in need. Ensuring that no senior citizen goes hungry is an important goal for our country. The consequences of malnutrition are devastating. In addition to personal hardship, senior hunger also costs taxpayers in the form of higher health costs. Unfortunately, it's not as simple as waving a magic wand of government and poverty's gone or hunger is gone. We've been doing this a long time with some success and some failure. The Older Americans Act of 1965 was originally passed as part of LBJ's Great Society War on Poverty. Since 1965, the federal government has invested over $51 billion in non-inflation adjusted dollars in the Older Americans Act programs. We must ask ourselves, if government is capable of ending poverty for seniors, why haven't we succeeded? We should ask if private charity is also capable of feeding the hungry, and do government programs crowd out private charity? We should ask why we have 70 duplicate federal programs for nutrition. Today we are focusing our discussion on senior hunger and nutrition services within the Older Americans Act. Nutrition programs make up $818 million out of the $2 billion spent on this program. We will be discussing multiple nutrition programs, including the Congregate Meals Program, Home Delivered Meals Program, Nutrition Services Incentive Grants, etc. These programs are just a few of the dizzying array of federal programs related to domestic food assistance. The GAO recently issued a report finding that there are over 70 duplicate programs, 70 duplicate federal programs dealing with nutrition. 18 of these duplicate federal programs are primarily dealing with nutrition, and 6 of these duplicate federal programs are for seniors. We have a chart here that gives you an idea of how we do nutrition assistance. Like so much of government over the last several decades, we just add more to it. So we've got program after program, a dizzying array through this algorithm. We must ask, what if this program didn't exist tomorrow? Would people still get food from the government? Probably from 69 other programs they'd get food. For example, what if we did this? What if we did food stamps, made the food stamps cover those that they're not covering, give the money to states, let the states administer it, and get it to hungry people? It'd be a heck of a lot simpler. The thing is that administration of programs, any programs, is notoriously inefficient the farther it is away from the people. The closer it is to the people through the states, the more efficient the program is. We should feed hungry people, but we shouldn't feed people who have the resources to feed themselves. We should feed hungry people that private charity is not feeding, but we shouldn't feed hungry people that private charity is feeding. We should try not to duplicate ourselves. Why? Because we spend $2 trillion we don't have. So we're having to borrow money from China, borrow money from Japan, borrow money from Russia. The list goes on and on. We do not have unlimited resources, so we have to rethink what we've been doing for the last 50 years. We're in a big mess as a country. It doesn't mean we cannot help those who need help, but we should be helping only those who truly do need help. Are we advertising their services? How much money do we spend advertising? In my town, there's somebody going all around the state. They're advertising the newspaper. If people need assistance, let them know where the assistance is, but do we have to promote the programs and have a promotional budget to promote the programs? But I think we need to simplify these things. As a whole, the government spent over $90 billion on food, nutrition, and assistance in 2010. This isn't including Medicaid. We are spending an enormous amount of money, and we need to spend it more wisely. We need to cut out the duplication. Meals on Wheels, has a great history. My grandmother delivered Meals on Wheels to people for most of her adult life. When she could barely walk up the steps in Pittsburgh, she was still taking meals to others who she thought were less fortunate than herself. So there are good programs, but we must ask how many of these programs can exist and might exist if we get the government out of their way. MIT researchers Jonathan Gruber and Daniel Hungerman have written an excellent paper finding that every dollar of federal spending, there was a corresponding 3% reduction in charitable giving by the churches. Overall, they found that government or federal spending led to an overall 30% decline in charitable church giving. There are many great programs out there. For example, Walmart Foundation made a $2 billion commitment to hunger relief efforts in the U.S. through 2015, almost equal to this federal program. You have to ask yourself, if you had $100, who would you give it to? Would you give it to the federal government to say, will you help some people with my $100? Or would you give it to the Salvation Army or to a private charity that does a much better job, that's much more efficient and gets people and does help people in your area, and you can go and see the help directly? You have to ask the difference also. Is there a difference between charity, private charity, and the nobility of private charity, and then the sort of the bureaucratic malaise of a transfer program that involves transferring wealth from one group to another? In the remarks that we will hear today, we will find out that only 13% of the people getting assistance from the OAA are said by the group who is making this determination, which, may or may not be the most objective, that only 13% of them cannot do this without, or would not be able to get this without OAA's assistance. So in other words, 87% of them could, either through food stamps or through other programs, or, since there really doesn't seem to be a financial indication for why you get this assistance, they could be affording to get their food on their own. So the question is really, do we need duplicate programs? Should we not be trying to get rid of duplication at the federal government level? Should we not be simplifying these programs? Should we not be sending these programs back to the states so they can have better oversight, so we can have less bureaucrats in the middle, less overhead, and more efficient distribution of services? These aren't questions that are just philosophic questions. These are questions that have to and will have to be answered because we as a country are out of money and we cannot just keep adding on program after program. Thank you, Mr. Chairman.
Thank you. Senator Franken.
Okay, I want to get to our witnesses and don't want to take too